Hi, this is Kathy Jakizik, editor of Healthcare Facilities Today. Thanks for attending today's webcast, Modern Space Visualization Technology and its Impact on Healthcare Operations. Our presenters today are Josh Melbagat and Braden Witt. Josh is the Healthcare Director for Dude Solutions, a provider of TheWorxHub for thousands of facilities in the United States, Canada, and the United Kingdom. Specializing in operations challenges unique to hospitals and healthcare environments, Josh offers perspectives on strategies to optimize the patient experience, improve productivity, mitigate risk, and achieve compliance. Braden Witt is currently the lead mechanic at Martha's Vineyard Hospital in Massachusetts. He brings a diverse skill set with a wide range of experience, not only in healthcare, but across an array of industries, including hospitality, event planning, custom fabrication, and television and theater production. His knowledge of technology and how to leverage it allows the hospital to gain greater efficiencies and business continuity. Today's learning objectives include define space visualization technology, identify how to integrate your CMMS and floor plans to drive staff productivity, discuss how the utilization of your space can drive smarter decisions, and identify the benefits of digital visualization for your organization. Before we get started with the webcast, I'd like to cover a few details about today's event. A live question and answer session will follow today's presentation. To submit questions, please use the Q&A panel on the right-hand side of your screen and send your questions to all panelists. Today's event will also include interactive multiple-choice polling questions. Your input is very much appreciated. At the conclusion of the webcast, you will receive a link to download a PDF copy of the presentation slides. You will also receive a link to a brief online assessment. Upon successful completion of this assessment, you will receive your CEU certificate. This webcast will also be archived at healthcarefacilitiestoday.com. And now, a brief word from our sponsor.
Dude Solutions is the leading provider of cloud-based operations management software for healthcare organizations, from hospital systems to individual sites. Dude Solutions combines user-friendly mobile technology with 20 years of operations data to empower operations leaders to do their job faster, easier, and more confidently. Today, over 1,000 healthcare organizations use TheWorxHub by Dude Solutions to manage their maintenance, asset compliance, capital planning, energy, and more.
And with that, I'll turn it over to Josh.
Thanks, Kathy. I really appreciate that introduction. I'm really happy to be here talking with a great group of people about space visualization, space management, and healthcare operations. I'm also privileged to have Braden Witt joining me. We're going to get into basically a little bit of background, kind of current state of space and hospitals. From there, we'll dive into a discussion between Braden and I about his experiences with his organization and how he's envisioned using space, what the benefits have been, how it's impacted the organization. And then we'll finish up with a brief view of the new space management pieces we've been working on and give you a visualization of what they look like. You'll get the chance to actually see how it's set up and what its impact can be from the perspective of an end user. And then we'll finish up with a Q&A, giving the attendees, the participants here, the chance to ask any questions you might have. Kind of pepper Braden and I with real-world stuff. I really love that part. So as we go through this presentation, please do use the Q&A section over to the side to put in questions as they come up. Don't just wait till the end. If you put them in as we're going, we'll have a nice little batch there, and we can dive right in once we get through the presentation. So with that, first polling question that I'd like you to take a look at should be coming up there. Wanted to get a feel for are all of your architectural and life safety drawings stored in a single place and format? You've got a yes and a no there. Pretty simple. What I'm trying to get a feel for here is, where are we overall within the participants here in terms of already kind of storing those digital or those drawings in one place? We find typically they're pretty scattered. So we'll give you a minute to fill that in, and then Kathy will share with us the results. Now, as we're coming through and you're thinking about this, I'll share with you some stories I've been through. I've been to organizations where we sat down and seen, 6 different drawers where all the drawings are. Half of them are not really set up, all kinds of stuff. So, whatever you've got, I'm sure we've seen worse, or you might have the best thing out there. Who knows?
Okay, we have some preliminary results, and we have 44% say yes. All of their architectural and life safety drawings are stored in a single place and format, and 56 say no. 56%.
Thank you, Kathy. So we're about 50-50 there. I'm sure that if I had asked, are those drawings digitized and readily accessible, would have been a little lower. But the first step is you've got to get the drawings together. So it's great that half of you do. We'll talk more about that as we go. So in terms of the current state of healthcare relative to space, there's some highlights and trends that I want to start with here. So basically, as we've been through this, we've found that there's really some inherent kind of inefficiencies in organizing and locating the paper-based drawings and artifacts. There's a cumbersome process. You got to go and search and find them. Really not having that centralized kind of repository of the architectural and life safety drawings and the different layers leads to a lot of wasted time and stress flipping through binders or searching through offices or going back to something where they're pinned on the wall. So we're seeing that there's also a lot of interest in having greater insight into how that space is being utilized. We see that the trend, of course, with reimbursements being based on space usage. We see the need to actually know what are we allocating to patient care, food service, diagnostic, treatment, or other cost centers, being able to actually modify that in real time and see the impacts, all things that are bubbling up, if you will. Now, in addition to that, we've started to look at kind of the idea of how do we get more efficiencies and better understanding of our building, our space, what we have to do through mobile technologies. It's that idea of having a picture goes a long way. Immediately when you see something, you understand what's going on. So if I have a map of my floor, building, whatever that might be, and it says, here's where my work orders are, right away I know where it is I'm going to do things. If I can see on that map where shutoff valves are, I know where I have to go. I'm not searching for things or trying to interpret someone's handwritten note. So that becomes a big deal there as well. And then we've got this normalization that's starting to happen. It's been around for a couple of years now, let's say. And the idea of we now live in a world where we have access to information anywhere and any time. 8 in 10 Americans own a smartphone. 85% of folks that we're working with, so facilities directors, technicians, that type of person, they're using mobile devices daily as part of their job. I know my wife jokes with me that I'm basically married to my phone more than her because I spend so much time on it. And it's that allure of information is there as soon as I want it. It saves me time. It streamlines everything. So this mobile idea and being able to access information without searching for it has become really big. Now, within this, if we look at this from the perspective of, okay, that's great, so what's the issue then? What's the problem that's coming from this? So looking at this, you've got a couple. You've got limited access to this gold mine data set of your space drawings. You can't use them if they're in a box on a wall, just there for one person. It's inconvenient for new staff members to even understand the layout of the building. It's tough for surveyors when they come in to know where things are, to easily navigate. And we've found if you make it hard for them, they tend to search for more problems. They want things easy. We all do. You've got the business continuity challenges when staff changes. That idea of not knowing where shutoff valves are, not being able to visualize that. If I've got to shut something off, I don't really want to go and search and find the right layer in a binder or in drawers. I want it right now. So that goes back to that lack of centralized way to house documentation. We don't have everything in one place. We need it there, so that slows us down when we don't have that. And then that last point about visibility into space utilization. What percent of our space is going to this type of area, cost center? Being able to pull that as building usage changes is really a challenge. So if we come back to kind of why visualizing your space really matters, we're talking here about first your organization. So this simplifies the technician's day-to-day life. If we can give them a way to see what's happening with their work and know where it is and give them that access, they're faster in terms of their ability to actually turn work around. We're going to increase their productivity. They're also going to get work done faster. They can actually plan things out, plan a route, and do work in sequence. We're going to streamline staffing and schedule. So we're going to be able to get staff up to speed faster and distribute work in a more efficient way because they can actually look for themselves and say, hey, what's open around me? What needs to be done? We'll show you some of that at the end when we get into what this actually looks like. And then finally, we're going to map out the compliance needs. So we're going to integrate the compliance needs, documentation, inspection requirements, into your facility map. So if you're doing a round or something like that, you actually see a map of where these things are and can easily find them and make sure nothing's missed. So continuing down this path, we're going to give access to the documentation faster. We're going to store historical information on the equipment and work orders. That's just part of the maintenance software side of this that gets integrated in with the space piece so that I can pull that up while I'm on a map. We're also going to get into, again, that idea of utilizing the space and identifying how it's being used with charts, really easy things that update so you see that. And we're going to go mobile. So we're going to push this data out to technicians and staff. We offer an integrated maintenance software and space management solution. So when they pull up that shared map, not only are they looking at the layout of that floor or area of the building, they're also seeing all their work and the assets and everything laid out in that space. So when we get into this, we also find that once we layer these space drawings on, the inputting of work order requests from staff is much simpler. They typically don't understand where they are in a building when it comes to the facility side, and you'll get requests that might say nursing station or this bay. When you put space in, they can actually identify where they are by clicking on a map and put in the request exactly where that problem is, simplifying things for you when you go to do the work and giving them comfort that everything is taken care of. So with that, what I'd like to do is talk a little bit with Braden about your experiences. Braden, are you on the line now? Can you?
I'm here.
Fantastic. Thank you so much for joining us.
My pleasure, as always.
We've had the privilege of working with Braden and Martha's Vineyard Hospital and working with them both on the CMMS or maintenance software deployment as well as the space management piece. So first off, Braden, at the beginning, your introduction, your official title, I think, is lead technician, but I know you do way more than that. Can you give the participants just a brief kind of rundown of what your role is at Martha's Vineyard?
So my title is lead mechanic, which is very vague as I've come to learn the more things end up on my plate. I oversee HVAC building automation, CMMS, our team here, energy management, biomed, water management, basically anything that needs electricity or technology probably lives on my plate, along with a huge piece of our Joint Commission regulatory component of operating a hospital in today's modern world.
Fantastic. So you're one of those people who really has their pulse on what's happening in the building and how it needs to be maintained.
24/7.
And are you the one they go to when things go wrong?
Constantly, yeah. I'm surprised there's not people lined up at my door right now knocking on it.
So in terms of kind of the participants that we have on this call, can you give us a little bit of kind of the picture of what things looked like before we started working together on the maintenance and the space pieces, just to give some context and background?
When I started here at Martha's Vineyard Hospital, we were just starting to roll towards TheWorxHub from one of the dude's older products. Mm-hmm. And we lived in a platform that wasn't so much built for healthcare. And so as we rolled into the TheWorxHub, it's allowed us to grab hold of the healthcare operation needs of a facilities department. From those regulatory concerns, big, complicated preventative maintenance programs, and just the day-to-day life of the demands of a small team running a rural critical access hospital.
Mm-hmm. I think that's one of the things that we've really strived for on our end is building solutions that are specific to the people that we serve. So on the hospital side, it's looking at what are the unique needs there. Was there anything in particular that kind of you were looking to solve or looking to have be better when you were transitioning to the TheWorxHub?
One of our biggest two initial parts were preventative maintenance and better preventative maintenance planning and management and regulatory, and managing those hundreds and hundreds and hundreds and hundreds of pages of compliance code and finding a product that was built around those needs. And in the healthcare space, everyone's got a CMMS tool they want to sell you, but very few of them have that compliance mind built into them and are built with the tools to give compliance that leading edge into technology.
And today we're talking more about the space side, and if I recall, one of the things that you had talked about being important down the road was including the space visualization or space management side within the work orders PM and the compliance side. Can you talk a little bit about where that fit for you?
Well, we are, as we've started rolling in space out, it's been a huge benefit in several ways. It gives our technicians a quicker glance at where they're going. So if we see there might be a department that's got a lot of work for that day, my team, without having to run reports or dig into any data, can just look at a map and say, oh, hey, the ER's got 21 work orders today. Let's focus our attention right there. Or when we have vendors coming in the door, I can just pull up the map on the big screen down in our workspace, and we can show vendors, like, here's where you're going. This is what this is, to help them have a little bit better stance of what goes on in the building. So those are two big places where we've initially seen the biggest payoff of space, is just being able to see on a map, here's the highlighted areas, here's where your work orders are right now.
And how did you do that before? Was that just like go turn left at this hallway?
You turn left at this hallway, or we'd give a vendor a work order and they kind of had to go navigate around the building, or the team only could see what work was on their tablet for that day. So now they're able to look at the facility across the board, across all departments, and see the full workload without having to be able to run a report or dig into any data. They have that ability to look across the whole facility. So if we have 2 people call out for the day, it doesn't mean all work stops. It just means that we have another place to go look and see what's going on.
Mm-hmm. I think that, for us, that's one of those big things is I know one of the guys that I work with a lot calls it the democratization of data and making it something that's available to all the different roles in the organization as opposed to it being just in, your head or someone else's head. Right. So we're really big on that. Randomly, you talked about the maintenance technicians being able to pick data up and get to their work. How has the reception been on their side? I know sometimes people are concerned about, will maintenance technicians actually use a handheld? Or are they ready for it? What's your experience been?
They were all a little timid about it at first.
Yep.
They're like, great, one more thing he's going to shove down our throats this month. So there was definitely because there always is when Braden walks in the room with an idea, people are always like, oh God, here we go. But my team's actually been quite receptive to it. We're still kind of in the early rollout phases of working out exactly what we want it to look like.
Yeah.
But for just our higher volume work order areas, the teams really liked being able to just glance and see what else is in that area. Especially our night team, of being able to just look and see, like, all right, if I'm going to go hunker down in acute care to do light bulbs tonight, what other 12 work orders can I knock out that could have gotten forgotten and kind of locked down in the queue, or stuff that's coming in real time? So there's been a lot of curiosity around what exactly are we doing with this, because it's so well connected to our assets and to our work orders that I see it becoming more and more the go-to starting point for my technicians.
Mm-hmm. Yeah, that's one of the things that I found really interesting. Before, when I worked with organizations, we would start with this assumption that people would work from essentially a task list and work down in descending order, and you in your role might prioritize things for them, so they'd just look at things kind of individually. But with the space piece, one of the things that excites me is this ability to actually see the big picture. And instead of just working from a list, I can say, oh, wow, I've got 15 of those things in that emergency room. We got to get to, focus our efforts there. Not only is that going to deal with a hot button area for us, but it's also going to make us more efficient because we're not walking back and forth, between jobs. So big things there. Is there anything else that kind of you've pulled out as a big value of integrating the maintenance software, the CMS, and digital floor plans?
It's all one product. I'm not having to swap between, before I had everything, we have our master set of paper prints for our newest building. We've got several areas in construction. We've got a really old building, and now to be able to take all of those most highly used pages of floor plans and connect them into the work we're doing has meant less time of people lined up at my office needing pages or wanting to know where's this page or where's that page. And so it's taken that archaic process of having to, flip through pages and pages and pages of floor plans to being able to say, well, here's the asset, here's the valve, and not needing to rely so much on having to maintain as many drawings, because now I can just drop an asset, as you're going to show in the demo, drop a pin right on the map of, all right, here's a new valve, here's a shut-off, here's a shutdown, here's an air handler, here's where equipment's going to be moving to. And so it's really given us the ability to just streamline streamline the drawings into the workflow instead of having to go find the drawings to dictate the workflow.
Mm-hmm. When you talk about the people who come to you and ask for stuff, who are the people that are asking you for that information? Is it kind of all different folks in the organization?
It could be vendors. It could be people from management. It could be, it depends on the day and what's going on in the building. So just being able to show someone less information but more useful information has been a lot easier than instead of, 10 people standing over the same blueprint. You can just show them in the real map now, oh, and here's all the VAV boxes. So you don't need to go through 14 pages of where my VAV box is. You can just see them on the map now.
Have any of them been particularly surprised by how kind of fast you can get the info for them?
They're surprised at how much I can track them now as they're finishing work orders, so that's been amazing. So that's been really nice. Or to be able to track people down as you can kind of track through different stuff, to be able to go find where your team's at has been really nice too.
I like that. So another area that gets talked about a fair bit is space utilization. That idea of the cost center of a space. How is that kind of impacting you? Is that driving kind of different decision making at Martha's Vineyard, or how are you using that?
We're right now as most hospitals constantly face, is a need for office space. Every new idea comes with a new person who comes with a need for a new office. So something that the dude's done brilliantly in the space tool is make it with 2 clicks. I can see exactly in each drawing in each drawing, I can see exactly where my allocation is. And we made the effort when we rolled out WorxHub initially to make sure we had categorized all of our types of space So now it's just a couple clicks. I can just look through and show, like, upper management. Here you go. Here's the map. Here's how much of that space is being used by what? By patient care, by offices, by storage, and et cetera. So that's been very, very handy just to have that information there and a click away.
Mm-hmm. Have you ever had a problem with what I call them, squatters, kind of just plunking down in an office and treating it as theirs?
Oh, yes. Oh, every day. Every day someone's trying to claim that, well, we didn't think it was being used, and now I can go back and say, well, there were 11 work orders put in last week by someone who's just on vacation. It's not your space yet.
Yeah.
Or to understand those inefficiencies in how things are laid out, to being able to look at the map and see, all right, well, this office is serving this department. Where could we move it closer over and improve some efficiencies that way? So it's just made it easier to look at where things are by color-coded breakout.
Yeah. So having seen the tool and worked with it, who do you think that the solution would best help? Is there anyone in the org that you think really they're going to get the most benefit out of it, or does it go cross-spectrum?
I think the first initial big one that the big benefit's going to face towards are facility managers and facility directors, who need a better way to make decisions about 3 steps forward, or to be able to look and see, where's my team at today, where's the work at, what information can I show the C-suite to be able to pull up on a map and show these are the hot spots right now based on work order numbers. So I do view that management level, I think, has a lot to gain from the tool in different ways that they can use that data at a real time. Instead of handing out an Excel spreadsheet of here's what we're doing, they can pull it up in a visual way and say, here's where the work orders are. Instead of showing a CEO in this a complicated spreadsheet, they can just pull it up and say, here's what we're doing in the ER today. Here's what we're doing in the OR. Here's where we are right now, which I think is really exciting.
So you've been through now the startup process. For the participants on the line, your peers, is there any advice you'd give them setting up a space management solution, or choosing a solution?
With the TheWorxHub, if you're new to the TheWorxHub, spend that time really building out those details into your locations. And if you're already on the TheWorxHub platform and you're looking at adding space, I would definitely recommend spending time to work through your locations and populate as many fields as possible. But it makes the product way more useful when you've got all that data ready to pull. Photos of space, square footage, usage, and all that kind of stuff. That's where space really becomes super easy for everyone, is the more data you've already fed into it at the front end.
Yeah, it's one of those things where when we were working on figuring out, what are the services that we need to offer to support this, is it as simple as, people send us the drawings and we simply draw boxes on a map for them, or is it something where we go out and actually walk the building and take those floor plans and do the mapping and the whole kind of creation of space? And we found that, the need really varies, so we've broadened the scope. I think with you, we did it pretty much completely remotely, right? We just took your drawings and load them in?
Yep.
Yeah. Any other advice you'd give, or last words you'd give to anyone about space or anything there?
No, I think it's something that I think is still kind of an emerging new idea, but I think the sooner people get in on it, the more results you'll see from it. Before the market becomes too saturated and it becomes impossible to make decisions, starting a little sooner, I think, makes it a little easier to get into it right now.
Yeah. From our perspective, we see this as kind of the next step in really managing the operations and the facility side of a hospital. That ability to see everything and actually consolidate the information is what really facilities directors are going to have to start to look at in, the coming years as things become more complicated and we need more access to that information. So with that, what I'll do is I'll transition. I'll give folks on the line a brief glimpse of what we've been working on, and then we can switch it up to a Q&A side. So let me go back to a little presentation there. So I built into this with some help from others on my team, some little videos to give you an idea. So what I've got here is basically the idea of what a drawing looks like and how you can essentially explore your spaces when they're uploaded. So what you're seeing here is a drawing that we've scanned and uploaded to the system, and then each of those boxes that you see is a different location, and you can click on any one of them to pull up detailed information. As you're seeing, I'm clicking on room 1 here, get a picture of the room if I've chosen to load one. I can have attachments connected there that I can drill into. It's all there for me in one place. So that's step 1, is we need to get the drawings uploaded and set up. That's the jumping off point, if you will. Next, we can layer onto that the actual work orders. So what we're doing here is actually taking that drawing and identifying work orders that are on them. So I turn on my work order layer, shows me where on this space my work orders are. When I click on them, it actually opens up those work orders. I can view them, drill into them, see connected assets, get that full picture, and even see pictures that are attached to that request. So this one that I'm using the scenario on is one where someone said, hey, there's a box that's been stored next to the sprinkler head, probably a compliance violation. Here's a picture of it so you know what to go look for. Totally changes the way that a facilities team can respond to requests. Gives them a quick way to identify that. I also love the idea of taking pictures like that because you can then layer that into staff training to educate people on what not to do. Then you've got that ability to locate your assets. So I talked about the work orders. The next layer on the map would be assets. What's where? And assets can be anything you decide. In this case, I've highlighted a fire extinguisher where I'm actually connecting that to the reception area. I've got it loaded in. I can connect to its safety data sheets so that I have those connected to it as well. Again, because this information is going to be accessible on mobile devices, I have everything at my fingertips regardless of where I am. I'm not searching for an asset listing or trying to find a tag. This is going to kind of consolidate everything into that one place. Then we've got the idea of keeping your drawings updated. So things don't stay static. Space usage changes. Sometimes the numbering system changes. We've built this so that it's very straightforward for you to be able to go into the system and identify and map new spaces or adjust existing ones. You can do free-form drawing for weird shapes or just do the rectangle boxes, which is most of the stuff that we have, and you just connect it to locations or add new ones, and you're storing all your key details there. That really just makes sure that you're constantly current on the space designation and usage and identification. So then we get into layers on our drawings. This is where things start to get really cool from a compliance perspective. Instead of having, one binder that I flip through that's got all these layers or a PDF that's static that I have to turn things on and off on, all this information gets integrated into the TheWorxHub, and we can add these life safety drawings as layers that we can turn on and off. So whether we're looking for a way to find our smoke partitions, 2-hour rated firewalls, exit paths or exits, gas shutoffs, it's all just a click away. I'm just clicking off over on that right side the different layers that I want to look at, and they appear. And you can adjust these over time as well. These just become layers that are placed on top of your floor plans. So it's a really great way to manage this and make sure that that information is disseminated out to everyone who needs it. And then finally, we've got this idea of how is space actually being used. So this is where each one of those spaces that we're loading in, we're actually designating a utilization by, essentially. So, whether that's the type of space, comp center, a floor plan, there's different ways that you can identify this info. But when you click on that usage button, it's actually giving you the summary info, and then we can report on that as well. So we can see the percent of space that's utilized by patient care areas, surgery, whatever the cost centers are you want to track. And because this is something that you can modify, it's real time. When you change utilization, it then updates. And then the last piece ties back to the idea of integrating and enhancing the core CMMS platform that we've built. So the space management piece is one section of this, but it fully integrates with our work order management, preventative maintenance, compliance, and rounding tool. So what you're able to do is actually, from the work order, go to the space drawing. Instead of just starting at space and working back, it's a two-way street. So I can find out where things are located and easily track back to their information and not have to go and search somewhere else. It's that idea of, again, integrating all of this data together so that it's all centralized and easy to access and doesn't hamper my team or your team's ability to do their work. So with TheWorxHub, essentially what I gave you a snapshot of today and what Braden was so kindly talking about was our space management component, but we take a much more holistic and integrated view of this. So space management is one part of TheWorxHub. We've got our maintenance component, which is the work order management, preventative maintenance, asset management, project management, those types of things that gets combined in with the space. We can also layer on these other bubbles that are being identified here. You can talk about doing your environment of care rounding or your survey and inspection process and integrate that into the work orders. We deliver a capital planning solution, inventory management. There's even a security piece for rounding and incident reporting. We've got an IT request system, housekeeping, and then WorxIQ is our benchmarking tool. Our software is totally web-based, and what that allows us to do is actually anonymize data from multiple organizations and create benchmarks that you then can access through that tool. And then, because we've identified additional needs, we've even built out solutions for energy management and event management as well. So with that, I'd like to put up another poll here, give you the chance to identify yourself if you're interested in learning more. I promise we've purposely not hired crazy, pushy kind of salespeople. If you are interested, we've got a great team here that would reach out to you. If you tell them to go away, that's okay. They'll go away. So if you'd like more information on the WorxHub itself, the space management module, or energy manager or event manager, didn't really talk about those, but if you'd like some info, we're happy to send that to you. Again, our goal here is to educate people on what the potential is with our solutions. We're really trying to help as many hospitals and healthcare organizations as we can because we see a great opportunity, and we're really looking forward to growing that. We've got, like I said at the beginning, thousands of organizations on board, but that doesn't mean that we don't have room to grow and more to learn. And with that, what I'd like to do is open up the QA side. Kathy, if you don't mind, if we can see if we've got any questions, we can start to get into that with both myself and Braden.
Sounds good. We do have a couple of questions to start out, and I encourage everyone else to just look at that Q&A panel on the right-hand side of your screen and type in any questions you might have for our panelists. But to start off, this question seems like it would be for Braden. How do you plan on raising awareness to your staff about space management? What exactly is your rollout plan?
We haven't quite. We're kind of letting the team discover it on their own. We've kind of learned with rolling out technology initiatives with our team that works best is to kind of put it out there and let them start to discover it themselves and where they want to see it to go, and then reinforce those needs as they discover how they can use the tool.
Sounds good. Okay, and I'm going to guess this question is for Josh. How long does it take to get space management up and running?
The first piece is it depends on what you have right now in terms of drawings. If you've got something reasonable, and they don't have to be kind of perfect or pretty. We had some come in last week that were, yellowed at the edges, and just a picture of the actual architectural drawings. But if you've got those, we can actually import them and then do the mapping for you. If you've got locations already loaded in to a list, a couple weeks tops. If we're talking about, we're starting from scratch, you might be looking at 3-4 weeks, but it's not that bad at all, and we do most of the work for you.
And someone is asking, can they edit space utilization information? Or, I'm sorry, I'm reading this question wrong. They understand that they can edit space utilization information, but what about move management or stacking and blocking plans?
So what we're sharing here is version 1 of our space management tool. So we focused on kind of the immediate needs. The next step for us is to look at things like move management, kind of reassigning spaces, tracking the history, and possibly integrating in work orders for the reassignment, things like that. So that's probably version 2 for us, which would be, probably Q1 2020, we're looking at the next round of improvements. But if anyone is interested in talking more deeply about some of the expansion of the base stuff we're working on, let us know. We're happy to set up calls and get into the more nitty-gritty detail.
Awesome. And does Dude Solutions or the client incorporate the LS data, the LS layers?
So at Dude Solutions, we're big believers on making it simple for you, but not keeping kind of the control of things. So in the beginning, as part of our standard setup pieces, we take care of loading that in as long as you can give those to us, but you are able to modify those and update them as you go. So it's not like we're going to, hold control and you have to talk to us every time. We enable you to make those changes. But in the beginning, we set it up for you so that you get a rapid ROI or time to value on the solution.
Okay. And what is the best tool to manage the working data?
So in terms of working data, it depends what we're talking about there. For a deployment, we use project management tools to manage the sharing of information and the actual setup and to keep us all on track. In terms of managing information like work orders, assets, things like that, that would really be the maintenance side of the application, the work order side, the asset side, and the PM side. That restores or contains all of the base working day-to-day information. Okay.
And how do you enter all the data into the software? For instance, what do you do with areas that are very old and only have like old blueprints to work with?
Yeah. Like I said, when I mentioned the old yellowed kind of architectural drawings, we can work with all kinds of stuff. It's good. The diagrams that I showed you in those videos there, those were relatively straightforward, nice-looking drawings. Just imagine your drawing be whatever you have right now, but a picture of it. So with that type of data, if your blueprints are 50 years old and falling apart, you might need to talk about something there. But usually we find people have done updates to their buildings and they have something that's a little more recent, but it doesn't have to be perfect. Send us samples and we can tell you what we can do with it.
Okay. And we have a final question here before we let you go. Are you utilizing one just snuck in. I lied. We have 2 more questions. Are you utilizing a DWF file or a PDF file from an AutoCAD drawing?
Yeah. So right now we're focused on the PDFs, but we're expanding out to other file formats. We just went simple to begin, but AutoCAD, things like that, those are all on the roadmap.
Okay. And do you have any recommendations on asset management data and asset managing techniques?
asset management data and techniques. Braden, I don't know if you want to answer that in terms of how you manage assets and equipment information. I'm happy to answer it, but you might have some best practices.
All our asset management in the realm of facilities and biomed, well, not biomed, but really just for all of our facility data and all that, we do it all through TheWorxHub. From the moment it arrives until the moment we dump it in a dumpster, all of our asset management happens within TheWorxHub. Every work order, PM, warranty tracking, vendor management, it all happens within TheWorxHub for us.
Yeah, and that when we talk about the expanded view of encompassing space, asset management, and compliance work orders, for us it's essential that everything reside in the maintenance software. From a technique of managing assets, we look at kind of a process where you define what happens when we retire something. What's the procedure? If a department buys something new, who do they have to alert? Is there one central person that's responsible for storing that info? Because we find that asset management can really fall out of sync when you've got different departments buying stuff on their own. So we encourage things like annual audits, processes that department heads are aware of, forms that they can submit to say, hey, I got this new thing, or a process where they actually funnel through the facilities team so that you're in control of what's in the building.
Okay, and does the whole hospital staff, are they able to send in work orders?
If you want, I believe 100% that all hospital staff should be able to put in a request. This is a battle I have with some facilities directors, though. Some don't want it that way. Some want to restrict it. I'm a strong believer in opening this up to whoever you can to get them putting in requests, because it's so important that people, A, use their own eyes to identify problems and communicate them to the facilities department, and B, that they feel connected to the facilities team, and that they can actually, help make these buildings a better, safer place.
Well, thank you. And I actually think that was the last question. So thank you so much for all the information and for all your insights. It was really valuable. And thanks to everyone who attended today. Have a great afternoon.